We are here at the sequel of the movie, the second part of the movie, that is the second trimester visit of this lady. Now, apart from the routine antenatal care and whatever is done according to the routine, we will discuss only specific findings and specific visits which are important for a diabetic patient during pregnancy. Now, if you can see this lady with a very black big specs and she is smoking a cigar. Now, what does this signify? If we can see closely, the cigar symbolizes 6 and this lady's body 1. So 16 is what I'm trying to depict, and at 16 weeks she is wearing spectacles. That means we have to do a retina check, especially in those ladies who had issue during their first trimester visit. If the first trimester retina scan or the last scan had an issue, we will do an extra retina check again at 16 weeks. That is this lady and the cigar denoting 16. So the cigar smoking lady wearing specs for her retina check. We all know if we put dilators, pupillary dilators in the eye, there will be a lot of glaring, so you have to wear specs. So she's come with a cigar and she's wearing specs because at 16 weeks she's come for a retina check. Apart from that, in the second trimester, in the part 2 of the movie, we all know the shampoo anomaly. That means anomaly scan needs to be done. That is routine for all patients, nothing specific for diabetes. Now, the third sequel of the movie is the most interesting part of the movie. It is the anticlimax. So, what happens in the anticlimax? Now, this lady, she had come for a checkup, but she is astonished to see there is a crocodile at the checkup. Now, what is the importance of this crocodile? Crocodile is 2 and 8. So, at 28 weeks is what we are trying to depict with the crocodile. And she is seeing the crocodile. So, again, it is retina check. At 16 weeks, it was only for those who had an issue in the first trimester retina check, but routinely for all diabetic patients at 28 crocodile weeks, we will do a retina check. So after seeing the crocodile, she is very annoyed and now she goes to the doctor for some relaxation. She does substance abuse, which is she is smoking a cigar. Okay, now there the lady was standing with a cigar in the last video, in the last sequel, but here we have specifically focused on the lip with a cigar because the lip signifies 3 and the cigar is for 6. So 36 weeks is the time for all the chit chat. Now, after seeing the crocodile, she's very angry. She's come to the doctor with a cigar, that is at 36 weeks, and she's chilling and she's chit chatting with the doctor with the cigar. 36 weeks is the time, that is lip with the cigar, is the time when all kinds of possible final discussions need to be done with the doctor, because after this anytime she can go into labor, and if she is a complicated case of type 1 type 2 diabetes, she might also need to be delivered before term. So 36 weeks is your last chance to watch the anticlimax of the movie. So she'll talk to the doctor and ask the doctor, when will I deliver? How will I deliver? What will happen to my sugar? What will happen to my baby? Everything the doctor is going to tell. When you will deliver? How you will deliver? The doctor will tell her, first you go and do a scan. Let's do a scan at 36 weeks. Okay, we'll see the scan. What is the weight of the baby? What is the liker? How things are going? So then we'll tell you, and we plan, since you look uncomplicated, so we plan to deliver you at term, like that. So the time is discussed. Then mode, the doctor will assess and say, okay, maybe we will go for a cesarean or a normal depending on the situation of the patient. And sugar monitoring during labor. If we get a close look of this dog, the dog is depicting the number 47, that is during labor the blood sugar should be between the dog, that is 4 to 7 millimoles per liter. So the doctor will tell her this dog is very important during labor because your sugar has to be in between the body of the dog. Then after delivery also you have to be monitored for your sugar. Now this lady, the moment the basics are cleared, now the main question comes, doctor, what about my pain? My analgesia, my anesthesia, what will you give me? How will you give me? What in normal? What in cesarean? The doctor will answer it all when they will give a local anesthesia in normal delivery, whereas regional anesthesia or other things during her C-section. So that all doctor will tell. Now when she's done with her issue, she'll ask about the baby. What are the issues that my baby can have? What is the effect of diabetes on the baby after delivery, how to manage the blood sugars of the baby, all that the doctor will tell. And breastfeeding and impact of diabetes on breastfeeding, doctor will tell. Now after listening to so much, this lady says no more babies, too much, enough is enough. So she will also ask the doctor about contraception. So delivery, baby, breastfeeding, and my god, this is too much. So no more baby, and definitely an ultrasound. This is something very, very important about the chit chat at lip with a cigar. So 36 weeks. Now the lady is very, very careful because now she's come after 1 week and she knows that 37 weeks is a very good time. And last time doctor had told her that since you are a type 1 or type 2 diabetes, see this lady, she's pregnant with a caterpillar and a swan. With due respect to all pregnant ladies, this is just for memory purposes. So she's pregnant with a caterpillar and a swan, and she is wearing a Nike shoe. Nike shoe is very good to remember the letter 37. 37. The sign of the Nike shoe is very, very easy, makes it easy to remember the number 37. So the moment she enters into the shoes of 37 and she is carrying a caterpillar and a swan, now she knows that it is her time to deliver. And she knows this diabetes has caused so much problem to her all throughout, so she will never touch the lollipop. Never touch lollipop. What is this lollipop with a lip? This is 3 and 9. So 39 weeks. She will never touch 39 weeks. Never touch the lollipop because sugar has caused so much problems to her. That means a lady with uncomplicated type 1, that is looking like the caterpillar, and type 2 looking like the swan. So with type 1 and type 2 diabetes, this lady, once she enters into the shoes of 37, she will never touch 39. That is, she always needs to be delivered between 37 to 38 plus 6 weeks. This is the time that we have to deliver this patient. So now we know, but this is all for uncomplicated patients. Any complicated pregnancy with maternal and fetal compromise, be it gestational diabetes, be it type 1, type 2 diabetes, it will not follow this norm. It will be delivered before 37, before 40, before 39, whenever it is indicated. So these targets or time of delivery are for uncomplicated diabetic pregnancies. So now this lady, She did not touch the lollipop and she was delivered before the lollipop time. She has this beautiful friend who is carrying a different kind of baby. Now her baby is scared of, and this lady is scared to raft. She doesn't want to go for a raft. So she says, I will be delivered any time before she is below the raft. She always wants to be below the raft. She never wants to go above the raft because she's scared of the raft. And this raft with this person on the raft depicts 4 and 1. So, a patient who is carrying a gestational diabetes baby, a lady pregnant with gestational diabetes mellitus will never touch the raft, will always be below the raft. That is, will never touch 41 weeks, so has to be delivered by hook or by crook at 40 plus 6 weeks, either by induction or by cesarean, whatever is indicated. So, elective delivery by 40 plus 6, don't touch the raft, and over here it is elective delivery in swan and caterpillar. She will never touch the lollipop, so below 39 weeks, that is by 38 plus 6 weeks. This is all that we have to remember about the timing and mode and this and that about diabetes. So I hope you like the anticlimax. Thank you.